What if I tell you there's a diet that could make you drop weight faster than you could ever expect, and a medication that control your hunger like nothing else? But here's the thing, neither one is magic. Today we're gonna break down PSMF, or protein sparing modified fasting, versus semaglutide. Which one gives you faster, more sustainable weight loss? And more importantly, which one is gonna work best for you? Hey guys, I'm Dr. Carter with Mind and Body Clinic, and we are weight loss experts. PSMF. Is it worth restricting? Well, first of all, what is it? So the acronym stands for protein sparing modified fasting. Not really fasting because you are eating, but you are primarily getting your calories from protein, and that's it. Maybe a little bit of carbs in the form of non-starchy vegetables. The point of it is high protein, ultra low calorie diet designed for rapid weight loss. Yes, pretty low, but they have done some studies on it, and it does actually help preserve muscle mass, but particularly when we're doing something aggressive and we're having really rapid weight loss. What are some of the pros of the diet? Fat loss is faster compared to other diets. You're going to preserve muscle, and it could be a good short-term intervention. Some of the cons, extremely restrictive, definitely could be hard to follow long-term, and in fact, not recommended. In fact, not really sustainable for a lot of people beyond 6 weeks. The takeaway is PSMF can be effective if you're looking for quick results, but comes with sacrifices in the way of variety and comfort. Semaglutide, the weight loss wonder drug, well, certainly when it came out, it was the most effective weight loss medication we had to that point. If you don't know, semaglutide is what's called a GLP-1 receptor agonist. It controls hunger as well as blood sugar, and in fact was great for diabetes and worked very well for that. Semaglutide will help provide controlled, steady weight loss. And some of the pros of semaglutide is that it will reduce your appetite. For the majority of people, it can lead to gradual, steady weight loss and doesn't require such a dramatic diet change. Some of the cons include that it's a medication, so you do need a prescription, and the side effects, which include mostly GI, nausea, vomiting, possible constipation, diarrhea, headache. Those are all possible side effects. And certainly because it's slower, it's going to take more time to see visible results. Semaglutide can help control cravings, but don't expect a free pass on eating whatever you want. Faster weight loss versus sustainable weight loss. PSMF, definitely faster results, but higher risk of burnout for sure. Semaglutide, steady, controlled weight loss, perfect for a long-term solution. Which matters more to you, faster results or keeping the weight off long-term? What about the side effects? Here's the thing that nobody tells you about PSMF and semaglutide. They both come with side effects. Before you commit, let's dive into what you really need to know. For protein-sparing fasting, the main concern is nutritional deficiency, because we are eating a very restricted diet and it's very low calorie. So that is concerned, and those type of side effects you get dry skin, brain fog, mental fatigue. In fact, those are possible side effects. In regards to semaglutide, mentioned earlier, but primarily it's going to be around GI. Nausea is like the number one side effect people get if they're going to have side effects, but constipation, diarrhea, heartburn, these are all side effects that are possible. The takeaway is any weight loss method comes with its own trade-offs. The key is knowing which trade-offs are acceptable to you. Who should choose PSMF? Is the extreme protein sparing modified fasting diet right for you? If you're all about fast results and strict discipline, this might be your go-to plan, but there's a catch. That works ideal for people who want very quick results, particularly if they're preparing for a specific event like surgery or a wedding. It's also good for people who have experience in dieting before. If you're willing to be strict for a short time period, this could be a definite option for you, but certainly you want to have a transition plan once you come out of the diet. This is not a diet for the faint of heart, and also I would say that should be done with medical supervision because of this low calorie count. Who should choose semaglutide? Well, that's best for those who want long-term appetite control and they struggle with either portion size or emotional eating. Definitely will help in those scenarios. Definitely people who want gradual, more sustained weight loss. And the question sometimes people ask is like, will it work if I don't change my diet? Sort of, yeah. You probably will see some results without changing your diet, but that's a big mistake. Generally, people who have not changed their diet during the use of semaglutide will gain the same amount of the weight back. Definitely not recommended. The takeaway is semaglutide is not an excuse to eat whatever you want. It's a tool to help you manage cravings and hunger. But what if you could combine protein-sparing modified fasting and semaglutide? Sounds too good to be true, right? Let's see how this could work for you. You got semaglutide working to control your cravings and the appetite. And then you got the PSMF on the other side with the rapid fat loss. The pros and cons of this include that it's more balanced and more realistic approach to maximize fat loss while preserving energy. I don't recommend utilizing the PSMF for an extended period. What you could do though is do it twice a week, meaning you have 500 to 800 calories of this high protein twice a week, not in consecutive days though. And this was actually mimic a style of intermittent fasting where a modified fast twice a week would eat your normal the other 5 days. So it worked great in that scenario to make it easier. So that's where it really would shine. Found this helpful. If you have, please give us a thumbs up or subscribe. If you have any questions on either semaglutide or protein-sparing modified diet, drop a question in the comment below. Otherwise, check out one of these videos on weight loss.